There's a opiate epidemic in America, and I think there's a lot of people who would like to do something to improve that.
New rules meant to minimize the risk of opiate abuse. Rutland Regional Medical Center's Dr. Rick Hildebrandt says the state guidelines are well-intentioned but may go too far.
To have a law stating what you must do, that's not common.
As of July 1st, Vermont doctors must comply with specific regulations when prescribing opiates to their patients. They include a set amount of opiate medications that can be prescribed when treating acute pain and a required Narcan prescription when prescribing opiates over a certain dosage. Doctors must also check medical records to see if the patient has taken opiates before and brief patients on the risks of the medication. Dr. Hildebrandt worries the guidelines might pose a challenge to small-scale providers specifically.
The administrative burden of that type of workflow is quite a lot.
The hospital's chief legal officer, John Wallace, helped with the new regulations while they were being drafted. He acknowledges that they'll give physicians more work to do.
Anytime you add complexity and administrative burden to a physician's work, that creates problems.
But he does think the rules are a good start in the effort to address the opiate epidemic.
Vermont has taken an educational approach to kind of making sure physicians understand and follow clinical practices and that patients are educated about the risks.
Hildebrandt says at the end of the day, a group effort is what's needed to ensure patients aren't abusing opiates.
I think by working together, we can combat this problem in a collaborative way that's going to help our patients and our communities to get better.
In Rutland, Helena Battipaglia, NBC 5 News.